Good morning. My name is Jen Scherzay, and I want to welcome you to today's webinar focused on engaging students in your nursing research course. Today's presentation is hosted by authors and faculty members Dr. Nola Schmidt and Dr. Janet Brown. In addition, we're also joined by Liam Butler. He's one of our ETCs, or Education Technology Consultants, here at Jones & Bartlett Learning, and he will be giving a product demo of the online course, Navigate to Premier Access, which also accompanies this text. This course is completely free with each copy of the text and has loads of features, instructor resources, as well as student resources that you'll definitely want to hear about. All of the participant lines have been placed on mute, and if you have any questions that come up during the presentation, either for Nola or for Janet or even Liam, and you want to ask a question, you can find me, Jen Scherzay. I'm the organizer, and we'll be taking Q&A at the very end of the presentation. You will notice that there are a few handouts in the handouts pane. You have a copy of the presentation as well as a few sample chapters of the textbook, and we're also recording this presentation, and the link will be available and sent to you post-webinar in a follow-up email. And all of our nursing-related webinars, if you're interested in viewing an archived one, are available on the Jones & Bartlett Learning YouTube channel. So at this time, I'd like to turn the presentation over to Nola and Janet. Please go ahead.
Thank you, Jen. Hi, I'm Nola Schmidt, and we are really pleased to be here today that you've joined us so that we could share some tips about how to engage students in nursing research. I've been teaching nursing research for about, 15 years or so. I'm a peds nurse by background, and I got the course after Janet had it.
Good morning. I'm Janet. I, too, have been a nurse educator for many years and recently retired as Dean of the College of Nursing and Health Professions at Appraisal University, where Nola and I were together for quite some time. During this time, I taught the nursing research for a number of years and learned a number of do's and don'ts associated with that task. And when Nola began teaching this content, we had a lot of opportunities to share our experiences. And it was during one of these times that a vision for the first edition of Evidence-Based Practice for Nurses, Appraisal and Application of Research was born. Our goal was to create a text that was easier to read, focused more on EBP, presented the content into small bites so that students were not overwhelmed, and build in opportunities for immediate application and review. Faculty and students to these features have been really positive, and we're excited to share the new features included in the fourth edition with you this morning. When we were asked to do this presentation, we were asked to identify a pain point or an issue frequently experienced by faculty. Well, from our own experience, we know that a pain point is often getting students engaged in the content. We often heard, why in the world do we have to take this course? We'd much rather be in clinical. So our objective today is to provide you with some tips about how to engage students and how the features in the fourth edition of our text can help. Faculty and students agree that there are significant advantages of the text. You can see from the slide the advantages for faculty. EBP and research content are combined to give students a better understanding of these concepts, and examples are provided throughout. Opportunities to determine understanding of the content are incorporated throughout the test your knowledge and critical thinking exercises, and students have agreed that these have really enhanced their learning. One exciting new feature of the fourth edition is the new topic selected for Apply What You Have Learned. Throughout the text, students are provided with the opportunity to apply principles being learned to a real practice example. The exercise begins with identifying a clinical problem and ends with a proposal for a practice change. We selected hand hygiene as the clinical problem because it's universal, interdisciplinary, and a clinical problem that students will encounter. In many of the facilities where our students do clinical, this very clinical problem is being addressed and is in the forefront, and they've been hearing about this. So we thought that it would be a perfect clinical problem and PICO question for them to work on. And we also wanted to highlight the issue in hopes that students become better hand washers. Like the previous editions, the Apply What You've Learned feature is built on a select body of evidence. Students are directed to articles that illustrate principles being learned in the text and provide them with an opportunity to work through the clinical problem, which is hand hygiene. There's a table in the front matter that summarizes the information needed for you, the faculty, and students to quickly obtain the articles.
Another really cool new feature of the textbook is the literature search worksheet. And you'll find this on the companion website at Navigate. What is neat about, first I want to tell you that this was created by a librarian and another nursing faculty member at the university here. And what's really neat about it is that it helps students organize their thoughts and organize their key terms so that they can search the literature systematically. And so they begin by identifying keywords and synonyms, and then they plan their first search by putting in these keywords and synonyms using the symbols that we are all familiar with. And then they can think about how they can do that search and see how many results they get. And then the fourth step is to encourage them to include the key term using either a mesh term or a CINAHL heading. And again, the worksheet helps them work through the searching the literature in a systematic way. Another advantage to this form is that now students have documentation, and so if they want to go back and look at the search again because they missed an article that they want now, or you can stop your search and resume it. I use this as an assignment in the course, and I give them a topic and ask them to find a single study. I've also used this for my own personal work as well.
Another feature that we're really excited about in this new edition is was done in response to faculty and student feedback. We redesigned the evidence hierarchy figure, which was a pyramid in previous editions, to a graphic with chevrons to eliminate confusion with the pyramid of the 5 S's. And we also added the types of evidence applicable at each level.
When I teach content about designs, I always make a sort of diagram to help students understand how things are related to one another. And so I would do this on the chalkboard or the whiteboard, and I realized that this, if I put it all together, would make a nice addition for the new book. So here is a new figure about the designs that groups them that we think will be helpful for students. Similarly, for statistics, we've also grouped the statistical tests here. We thought it was, it's the same sort of strategy, and you can see that we've grouped descriptive and inferential and epidemiological and categorize them as nominal and variable. And again, I find that the students really like this as a study aid as they prepare for exams. Oh my God, they're coming on.
Well, I hope that your students are this lackadaisical about research content, but we all know that some students don't get real excited. So we hope that the features that are now included in the 4th edition of the text that are really designed to enhance student learning are helpful. And we now want to turn to our pain point, or put another way, how do you go from this to this? Noah? Oh, okay. Go with me. Okay. One of the projects in the course is what we call an EBP team project. Immediate application of new knowledge is essential to learning, and we over the years have found that immediate application and working with the content has been key to engaging students. And this project is one that's done throughout the course. It's not an assignment due at the end, but rather one that requires students to work in teams throughout. Student teams are assigned a PICO question. Clinical problems are selected according to what evidence is available about various topics. Searches for systematic reviews and integrative reviews are a good way to scan for potential topics that you might want to assign to your research groups. Sometimes topics being featured in magazines or journals are selected, even though there's very little evidence available. This provides an option for students to propose further study. Some of the topics used in the past have included RNs removing chest tubes, protocol for school nurses regarding concussions, light therapy for patients with Alzheimer's disease. So you can see that there's a variety possible. Since a class is divided into multiple research groups, it's desirable to vary the populations across age groups, settings, and nursing specialty. Since student groups share their outcomes at the end of the class as a whole then is exposed to a variety of clinical issues. Rather than creating various clinical problems, it's certainly feasible to use the Apply What You've Learned exercise as an option, which also works well for both face-to-face and online offerings. As content in class is covered, student teams move to that step in their EBP project. For example, once searching for evidence is covered, students begin to search the literature using the form that Nola covered previously. They analyze the evidence they found and put information into a grid. The grid template is included on the website, and a completed grid for the Apply What You Have Learned exercise is available as an example. Students complete a grid for their group project as they progress through the course. Once grids are complete, students make a decision about whether there is enough evidence to change practice. If there is, they write a nursing policy, create a plan for implementation, and identify outcomes to measure to assure that their change is effective. If there is not sufficient evidence to change practice, they write an abstract outlining a research proposal to collect more evidence. The project culminates in a poster that students create about their EBP project. If you'd like more information about this assignment, we direct you to our article, and the citation is on there provided for you about the teaching strategy. We find it helpful to apply the model of diffusion of innovation to EBP, and we've used this framework in both the article and in the textbook.
Okay, so now we'd like to share with you some tips that we've used over the years to engage people in the classroom. And one of the things that I like to do is at the very first day of class, I give people an index card, and I have students put their names on them and then a fun fact about them. And then I use these cards throughout the course to randomly call on them. And plus, it's a great way for me to learn their names and for me to know fun facts about them. Because on average, my classes are running 60 to 70, and so it's a challenge to get to know the students, and this can be really helpful. Another thing I like to do on the first day is explain the features of the textbook and the companion website, because this will help students maximize the textbook and the features that are included. This is an example of something I do to engage students for Chapter 1 content. I ask them all to stand, and then I pose questions, and they have to sit down if they haven't done the activity. For example, I'll start with something like, sit down if you don't have a smartphone. Then I'll move to sit down if you haven't listened to music on your cell phone. Sit down if you haven't taken a photo, haven't synced with your car, haven't watched a podcast, haven't synced your phone with a watch. And so I do this to help them appreciate that they want to keep apprised of evidence so that they are on the cutting edge. And believe it or not, the students really like this. If you watch them, they're looking around the room to see who's sitting down and who's standing, and so they really tend to that. Okay, remember those cards that I just mentioned earlier? Well, this is when I use them one time. At the end of every lecture, I pose multiple choice questions. And so I'll use those cards to randomly call on someone to read the question and give the answer. I've also used clickers or to have polling, but I find that it's easier if I call on people because it helps me learn their names. And so if you don't have time or can't think up questions because you're really busy, feel free to use the questions that are posed in the chapters at Test Your Knowledge, because that's really all these are Test Your Knowledge questions. In Chapter 3, I engage students by helping them to see how to write a hypothesis. Turn to your partner. So I begin by telling them how to write the components. In this example, I use accidental falls in the elderly and walk them through how to pose the research problem, purpose statement, and hypothesis. The next slide then is blank, and it's about hand hygiene. And I tell them, now turn to your partner and complete the rest of this slide. And then again, after I give them some time, I use those white cards to randomly call on some people and ask them, well, what did you come up with? And this helps them see across the examples they provide how the same problem can be looked at different ways. Also, this random calling on makes sure that everyone works on what they're supposed to and doesn't just socialize during the time I give them to turn to their partner. They know they might be called on, and so they do the work. We've organized the course to have 4 sessions with our librarian, and this is extremely helpful. You'd think by the time they're seniors that they'd be very good at searching, but they still are novices. And so our first session involves a hands-on search using the worksheet that I showed you earlier, and the librarian reviews some ways to do an advanced search. Our second session reviews how to use the MESH terms or the CINAHL keywords. Our third session, the librarian introduces students to JBI, Cochrane, and AHRQ. The fourth session then, the students get in their groups, they have their PICO questions, and they organize a search. And the librarian and I are there to help them find evidence for their EDP team project. And again, here's the example of the systematic literature search worksheet that we use. It's extremely helpful, and some students have even told me that when they have to find evidence for other courses, they pull out a copy of this sheet and use it to do their search. Another strategy I use throughout the course is to do screen captures of articles that are used in the Apply What You Have Learned feature. For example, in the chapter about epidemiology, I've got a screen capture showing the table from the article by Ji, Yin, and Chen. I've highlighted the aspects that I want to discuss. Here, in this example, I want to show them the odds ratio to help them understand where the difference between an increased and a decreased risk occurs. And so, again, this provides the linkage from the textbook to the classroom. And the work's already done for you. You don't have to go out and find these articles. Just look for which article is at the end of the chapter and include it in your class teaching for that day. One of the funnest activities I have in the course goes with the sampling chapter, and it has to do with determining sample size. And in this class, I use a flip style classroom. I stole this idea from Roz Peters, who's one of the authors of some of the chapters in the book. I post a brief PowerPoint presentation with a voiceover that students need to watch before class. Then when they come to class, they use this worksheet and get a small bag of M&Ms. And what I'm having them do is I'm having them see if their little bag sample is representative of the population. And you can see across the top of the worksheet, I have the population that is of the different colors of M&Ms. This will probably change soon because they're adding a new color, so, but that's the colors for now. So I have the first student count their own bag. Then the next step is they pair their bags. Then the next step is they get in groups of 4. And then the final step is they get in a group of 8. And hopefully they'll see as their sample size gets larger, it is more representative of the population. Then in their groups of 8, I have them do some activities such as randomly select M&Ms, pick the ones that are closest to them, pick their favorite colors, and then determine which sample is closest to the population. And I hope that, I know that students really enjoy this session, and they often say, why can't all our classes be like this? I said,
as mentioned earlier in response to faculty feedback about the confusion between the pyramid of the 5 S's and the hierarchy of evidence, which we previously talked about, we designed the hierarchy of evidence in a new model, the one on the right with the chevrons, and included the types of evidence for each level. And I think this is going to be a very helpful clarification of this new 4th edition.
Get out your pennies. At the beginning of the stats lecture, I have the students flip a penny 10 times. While they're doing this, I play Stats for Life, which is a video that was created by University of Oregon students. It's kind of a fun, crazy little video that has them rapping and dressed up in costumes. And then I have the students come up and tally their count. Then throughout the lecture, I refer to this tally. For example, I turn it on its side and we look to see if it has a normal distribution. We talk about the likelihood of somebody getting 10 tails or 10 heads and whether we'd wait for this to happen. And I use this example to talk about sample fluctuation, that if we did this again, it would be similar, but it wouldn't be the same. For the qualitative chapter, I like to use an example where I have students tell me about planning a wedding. I do this because students often have trouble grasping what qualitative analysis is. And so by having students talk about planning a wedding, it's a fun way to get to know people and hear some really funny stories and also do a little brief data analysis. So I ask about 3 or 4 volunteers to tell me about planning their weddings. Then after they talk, I ask students to identify the themes. For one class, every student was having a wedding at a golf course. And I pointed out that if I really didn't know about weddings, I might conclude that all weddings are held at golf courses. And so that was a wonderful opportunity to showcase why researchers need to continue until they achieve saturation. Typical themes that the students identify include stress, money, time, and pleasing future mother-in-laws. And just a hint, I always am surprised at what they don't mention. It's not unusual for these 3 to 4 students not say anything about their fiance when answering questions. And so noting this helps students to listen for what is not said as well as what is said. I use different websites throughout the course, but one of my favorites is the Medicare.gov, and I use this in Chapter 18 for evaluating outcomes of innovations. Students are really surprised to learn about the availability of data that is mandated. So we put in our zip code and we look at the outcomes related to pain and patient satisfaction at the hospitals where they are having clinicals. This is a real eye-opener for them because they can see how patients can find this information and make decisions about where to get their care. And when they see this data, it helps them to think about what outcomes they might want to measure for their EVP team project.
Chapter 19 is filled with practical tips about the 3 Ps, posters, presentations, and papers. The EVP project presented earlier culminates in dissemination of the student group's findings. Posters are created and displayed in the college lobby over a couple of days, and this allows all faculty and other students to view the posters. There's a great deal of excitement generated by this, and faculty teaching sophomore students have developed an assignment whereby students do a brief write-up about one of the posters, which encourages engagement at the sophomore level. A Student Choice Award is presented for the best poster, and a photo of each group, like the one shown here, is taken and put into a slideshow shown at the senior banquet. The seniors are always delighted to see themselves and their work being recognized in that venue. The poster presentation has proved to be a very effective way to show students the importance of dissemination of information. Well, I hope that you found this webinar helpful, and we certainly encourage you to share your questions, and we will respond as quickly as possible to those. And at this point, we turn things over to Jen. So Jen, take it away.
Great. Thank you, Nola and Janet, for a really comprehensive overview of nursing research as well as your upcoming text. You're going to see the screen switch for just a second. Okay, actually Liam is already the presenter. So at this time, as we mentioned at the beginning of the presentation, Liam Butler is going to give you just a brief overview of the Navigate 2 course. The course that corresponds to this textbook, it's still in production. It should be ready shortly. So Liam will be showing you a course that has a similar look and feel. So I'm going to turn it over to Liam, and then we'll come back and we'll take some questions. I know I've already gotten several great questions from a few of you on the line there. So, please, if you have anything that comes to mind, let us know. So at this point, I'm going to turn it over to Liam.
Okay, thank you, Jen. I appreciate it. Today I'm going to be demoing pediatric nursing care, just because evidence-based practice, since the book has not published yet and it's going to be coming out soon, we don't have a Navigate 2 course to go along with it. But this course is going to work exactly the same. There will be some content differences between the two, but the functionality of Navigate 2 will work exactly the same. I also want to mention that with every new Navigate 2 textbook comes access to Navigate 2. So inside of the textbook, there will be an access code for students. And then we also sell digital access to Navigate 2 at a discount. So if students just want to get digital access to the course without a textbook, they can do that. And then also, just quickly, you can request a trial or a full demo of Navigate 2 through your account manager. So that's something they can help set up for you today. We're just going to do a quick demo and a preview of what you get with your Navigate 2 course. And then also, I want to mention that we do have an integration feature with Navigate 2 with Blackboard and Canvas. So if you want to pair your course with a Blackboard or a Canvas shell, you do have the capability of doing that. And if you need a test bank in another format, that's something you can reach out to your account manager and they can look into that for you. So this is the main page of Navigate 2. So once you log into the course, this is where you're brought to. Each course, when you get your own course, will have a course ID, and this is unique to your course, and it will be important for you because that's how your students are going to enroll into the course. Now, if we come over here, the Lessons tab, this is, once again, the main page. This is where all the content is stored. So if we come over here and open up a chapter, we're going to see all the content that we've preloaded into the course for you. So evidence-based practice will also have interactive lectures. These interactive lectures are a nice way for students to go through the content of the course. Once it loads up, you'll see it is set up in a slide-based manner for the students to go through. Each chapter will have its own interactive lectures for students. It'll just be one moment while it loads up. So as you go through, it is a slide-based approach to the interactive lecture. So students have to come over here and hit the next button. They can't just turn it on, come back, and walk away. Throughout the interactive lectures, we do have items that they can click on to get more information. And then we have also built knowledge checks throughout the interactive lectures for students to go through and test their knowledge of what they're learning in the chapter. We have a table of contents, so you can come over here. You cannot skip ahead to slides you haven't seen yet. You have to go in the order that's set up in, but you do have the ability to come back and go to previous slides that you have already seen before. Once again, we do have interactive lectures for each chapter, and any course that you see that is a Premier Access course for nursing will have these interactive lectures included. And then you'll find we have other items like the learning objectives, the slides, lecture outlines that we've added in. These are items that students can download, and they're also part of our instructor resources, so they're available outside of Navigate too. But what I really want to show you here is the ebook. So if we click on the ebook, this is going to be a digital version of the textbook. So once you click on an ebook chapter, it'll bring you to the first page of that chapter, but you do have access to the entire book once you're loaded up. Now, with our new version of the ebook that we have here, it is ADA friendly. So it is in HTML5. So screen readers are able to go through and read the ebook. So it is ADA friendly. You can also come over here and you can change the size of the font. So if you have someone who needs to have a bigger font to be able to read it on the computer, they can come over here and you can see it reflows the shape right to the page. You also find that in the ebook there's these dotted underlined terms. So if you click on it, it's going to give you that definition, and you can pull up those terms right away. Students can also click on the glossary icon, and they can find all the terms right from here. In addition, if you come over here to content, you can come over and find the different enrichments we've added into the course. So for evidence-based practice, you can jump right to the figures within the book. And with the new ebook, you can come over here and you can pull out these figures so you can get a better view, and you can zoom in as well. So you can get better images within the text. And then we've also added in ebook quizzes. So these are accessible directly from the ebook, but as you'll see in a moment, they're also available from the main page of the course. So these are preloaded quizzes that your students are able to go through. Once they complete them, it will grade it, and they can go in and they can review it so they can see what they got right and what they got wrong. And then finally, you can come over here, search for keywords and terms throughout the book. It'll give you a preview wherever the word is found, and if you click on it, it'll bring you right to that page, and it's going to highlight that word for you. And if we come back here, if students don't go into the ebook, they can still very easily access the ebook quiz right from here. Once again, once they take it, that grade will report directly into the grade book, and then as the instructor in the course, you will be able to go in and view their grades. So if we come up here, everything I've showed you so far is in this Lessons tab. We've also created this Learning Tools tab. It's the same content I just showed you, just rearranged in a different order. And then if we come over here to Teaching Tools, this is where you'll access materials that's just for you as the instructor. Students won't find this Teaching Tools tab. They won't even see it. And then over here, this is where you can find items like the Instructor Resource Guide that we've created for you. We also have an instructor manual that is available for you and a time on task sheet that we've made available for you. And that will just go over the estimated times of all the activities within the Navigate 2 course. Now, if we come back to the main page, what I want to just quickly show you now is how you can customize the course. So, as you can see here, by default, we have it in the order of the book, built by chapter. But you do have the capability of rearranging the chapters, so you can very easily move these around. There's a little move button here. You do have the ability to rename these chapters. So if you want to, do something more in a weekly based setting, you can very easily come over here and just rename it. And then if you need to, you also have the capability of combining chapters. So if you want to combine chapters and make a more of a module base where students just click on one topic and see multiple chapters, you do have the ability to customize it. And then if you need to, you can create your own topics. There's a plus and minus sign, so if we hit the plus sign, this will add a new topic into the course. So if you want to add in your own content, and maybe it falls outside of one of the chapters in the book, you can very easily do that. So one common use of this is instructors will go in and add in their syllabus into the course, and then they can move the topic to the top, so it's very easily found by the students. And then if you want to add content into the course, you can very easily just drag and drop content from your folder on the computer right into the syllabus, and it's going to automatically go in there and upload it for you. Now, if you want to add more content into the course, you can come to add an activity or resource. And this is where you have the ability to add in resources. So this would be content, non-gradable items. And then we have activities. Activities would be the gradable items you can add into the course. So you can add in assignments, discussion forums, and Navigate to Assessment. This is where you would add in your assessments into the course. So you have the capability of adding anything from a practice activity all the way to a graded final. You would add them all the same way. And then first we're going to go through the settings. So you can come over here, give it a name. You can choose when students can first take the test, when it's going to close, how much time they're going to have. You also have the ability to come over here, choose when they have the capability of reviewing this assessment. And then once you're done with the settings, we then have the capability of adding the questions into this assessment. And we have these prearranged categories based on chapter quizzes. Ultimately, you can use these questions however you want, but we've set it aside, so if you want to create a quick quiz using the 10 questions for chapter 1, you can come over here and add that. We also have suggested midterm and final, as well as practice activities. So these practice activities are gradable items just like the chapter quizzes, but we want to have it separate so that if you added 10 questions to a chapter 1 quiz, and then you're going to go in and create your own midterm, you know that these 10 practice activities have not been seen by your students. And the questions in the question bank here are separate from the questions in the ebook quizzes. So as students take the ebook quizzes, they're not going to be able to find the correct answers for items that you may add to a chapter quiz or a midterm or final. Once you create an assessment, you do have the capability of setting overrides. So these overrides are very helpful because this allows you to go in and give students additional time. So if you have a student that needs time and a half, we can come over here, change that time for the student. And we can also come over here and change the date. So if they need to take it at a later date, you can very easily do that without having to change it for everybody. And then finally, I just want to show you a glimpse at the gradebook. So if we go to reports and grades, the graded report is really the full grade book. So this is where you see all grades and all students. I just have 2 students in this class right now, but you'll see all the students here on the left. As they enroll, they automatically show up here on the left, and then all your gradable items will show up here going left to right. So if you want to review a quiz or a midterm or final that you created, you can click on the name of it right here, and you have the capability of pulling up the results. you can see all the students who have taken it. If they have taken it multiple times, you see each attempt here. And then you can review the quiz. And you can see how the students have done. So they have a question, on question 7, you know exactly what question that student had, because if you randomize the order or shuffle the order of the questions, question 7 may be different for every student. You also have the ability to get more information in terms of how the students are doing overall on the assessment. So if we go to the stats page, we can break it down and we can see all the questions that have been used on this assessment, how many students have taken it with attempts, and facility index will give you the percentage of students who have received a correct answer on that. So this is a quick way of seeing if there's questions that the entire class is struggling on, or if it's just a few students who are having trouble with it. And if we select the question, we can break it down by choice. So you can see how many students picked the correct answer, and then how many students chose one of the other distractors, and it'll give you a percentage of students who have selected that choice. And then also within the gradebook, you do have the ability to come over here and you can customize it. So if you need to customize a gradebook, set up weighted grading, you can very easily do that, and that's something that we can cover in a full demo. And then finally, if you need to export the gradebook as an Excel spreadsheet, you have the capability of doing that as well. So once again, that's a very quick preview, of Navigate 2. If you'd like to have a more in-depth demo, a one-on-one session, that is something you can speak to your account manager on, and we can get that set up. And at this time, I'm going to pass it back over to Jen.
Great. Thanks so much, Liam. So you might just see your screen change for just a second while the last slide back up there. So if you would like to request a review copy, I do encourage you just to visit the URL we have on the slide here. That's go.jblearning.com/Schmidt4E. If you'd also like to learn more about Navigate 2, you can visit jblnavigate.com/2. And Nola and Janet have also been kind enough to put their email addresses out there in case you do have any questions. And I know we did receive a few different questions that came up while we were going through the presentation, and Nola and Janet, most of these are for you, so I'll combine two of them. One instructor just wants you to reiterate the level of the text. I would assume whether it could be used in undergrad or grad, and then they wanted a few more suggestions for evidence-based projects.
Hi there. We originally wrote this textbook for baccalaureate level research courses. And that's really its original intended audience. But I have to be honest, I'm using it at the graduate level, and we use it at the doctoral level. At the master's level, it is the primary text for the research course, and the reason I've gone that way is because I used to be a big fan of the Polite and Beck version at the graduate level, but we've started to get a lot of international students, and that's just a little too difficult for them. At the doctoral level, I know that some people use it as a reference. It's not a required text, but merely a recommended text. So that's where we really, but our heart and soul is at the baccalaureate level.
But our own DNP students picked it up on their own, to be honest, and then started touting the advantages of reading it to refresh their knowledge base and to help them clarify content that they just simply needed refresher on. So it's been helpful to them.
Thanks, Nola. Thanks, Janet. We do have a couple more questions. You were talking earlier about the projects that you do within your class. We had one instructor ask how many students you typically assign to each team for these projects.
Okay, and I'm sorry, I forgot to answer the part 2 of the first question. I assign topics, and the reason I assign topics is because students sometimes don't have enough experience to come up with their clinical group and their clinical topic, and also sometimes they pick topics that there just wasn't any evidence out there for them. And so what I do is at the beginning of the course, I go into CINAHL or PubMed or whatever, and I put in systematic review, integrative review, and then I put dates that are a little older, like now I might do 2010 to 2014. And then I look to see, is there a systematic review on topics that I want to do? And this way then I know that there's evidence out there, but I don't go all the way to 2017 because I want them to have to search for those new articles that have, those new studies that have been conducted after the systematic review. So that's kind of how I come up with them. And then rather than telling them what their PICO question is, I give them a scenario. So for example, this semester, my students got some of the scenarios were your nurse manager is interested in having RNs remove chest tubes. She's talked with the surgery department and the physicians are amenable to this change. Go find, you're a task force and you need to come up with whether this is a policy that should be implemented and so on. And then they have to actually word their PICO question. Let's see, what are some other topics? This semester I did the baby box thing. You know, New Jersey is putting newborns in boxes, and that's a big thing in Scandinavia. So I had a project about that. Concussion, intercourse after a heart attack, asthma school teaching. I apologize for that. Exercise. And also as I look for them, as I pick topics, I try to pick things that are across the lifespan and across different disciplines. So I usually have one group that's working on something related to gerontology, another one that's a mental health issue. Oh, that was one I'm having them look at this semester, how to manage, how to reduce overdoses in the community. So that's kind of how I pick them. Either I run across a systematic review or it's a hot topic now in the literature or in the news. How many students I put in a group? I put 6 to 8 because I don't want too many duffers. But I'll tell you that, and I have used those white cards to put them in group randomly. I can also use Blackboard to do that. And I don't let them pick their own friends anymore because that doesn't work out well. So it's random, and I tell them that, hey, when you're on a committee in your job, you don't get to pick who you work with. You get whoever the units send to be a representative. And so I do randomly assign them. I used to, and this has been a huge tip that I've discovered the last year, I used to require one piece of evidence for each person in the group. And so if there were 8 people, there had to be 8 pieces of evidence. And what happened is that they didn't have a group project. Each person had, this is my article. And so no one would read the other pieces of article or do anything with the other pieces. They would just be very married to their one little piece of evidence. And so this year, my groups have 7 and 8, but I required only 6 pieces of evidence. And this really forced them to share the pieces of evidence and not have that mindset of their individual piece of evidence.
Thanks for that thorough explanation, Nola. That I think was a fantastic answer. And just one more question. I think we had a bunch that we've already answered, but it doesn't seem to be any additional except this last one. We have a few instructors that are wanting to know how you might use this text to teach online. They have an online course and are interested in some strategies there.
Well, the obvious answer is that if you're online and you don't have access to Blackboard or a similar platform, that you can use the everything in Navigate, because that's all web-based. So that aside, I don't think that there's that much difference in some of the things that I do, because you could still have your lectures online. You could still have them kind of, what do I want to say, like the M&M thing. They could go to Google Hangouts and talk about how many M&Ms they have and work through that worksheet. So I don't teach this particular course online, but I've taught others online. And so Google Hangouts is a good way. You're online and then you go to Google Hangouts. Also creating Google Docs where they can work on it on this one document all at the same time can be helpful. The EBP project, the Apply What You Have Learned project, the topic that comes with the book at the end of each chapter, you could actually use that as the EBP project for students to do either in groups, or really we have enough, we've done a lot of the legwork for them that they could do it individually as well, as an individual assignment if that's the one that you're going to have them go with.
Yeah, through discussion boards and through Google Docs, I think all of the tips, the activities that we talked about are really adaptable. It just takes a little bit of a different focus, but I think that it's all doable. Certainly, students can have a group presence with an online course. So I think that the tips are quite adaptable.
Any more questions, Jen? It seems like it's about time to wrap up.
Yes, no, we didn't have any questions. Thank you very much for all of your detail around those. And I want to just thank everyone for joining us today. A special thanks to Nola and Janet for taking the time to be with us and to craft this presentation and to provide us with some great strategies for teaching this subject area, and also for Liam. And just want to remind you that the textbook will publish December 15th. We do encourage you to request your review copy now so that you can get it before the end of the year. And you will be receiving a post-event email from us that will have a link to the recording as well as the presentation slides that we saw today and access to 2 sample chapters. So please look for that. And thank you for joining us today, and we hope to see you on another online seminar soon.
And I just want to say from Janet and myself, thank you so much for participating in this webinar, and thank you for supporting our book. We are just so pleased that people are using it and find it helpful.
Great. Thank you. Take care, everyone.